everyone, I'm excited to bring you this news about Chinese herbs. A combination of Chinese herbs in Taiwan is treating SARS-CoV-19 hospitalized patients. Now, this news comes from a study published and sponsored by the Taiwanese Ministry of Health. So to be clear, these are not my opinions. Taiwan has a population of approximately 23 million people, and yet it's had only 10 people die from COVID. Yes, 10. Taiwan has a nationalized health care, and they spend far less than the US per person, but I won't get into that. Chinese herbal medicine is included in their healthcare insurance, and it's commonly used in hospitals alongside Western medicine. I'm Kathy. I'm making this video to simply bring awareness to this news, which is often not heard in our mainstream media. I'm a licensed acupuncturist, herbalist, and functional medicine health practitioner. I've been discussing these herbs and others with my colleagues for the past year, as we've also been using similar combinations of herbs to treat our patients. Now, I'm going to read some parts of the study, and I'm going to paraphrase other parts. It's kind of a long study. There'll be a link to the study below, so if you'd like to read it for yourself, it'll all be there. Chinese herbs are continually being evaluated for respiratory illnesses, and many studies are ongoing, as is this one. Now, the formula, it's referred to as NRICM 101 in published medical literature. I'm going to abbreviate that name because it's just kind of long and refer to it as Formula 101. So the formula has been found to inhibit the SARS-CoV-19 pathogenesis in antiviral and inflammatory assays. Now, the real-world evidence began in April 2020, and it's offered insights into these well-known herbs. Now, pharmacological assays demonstrated the effects of the formula inhibiting the spike protein, viral plaque formation, and the production of cytokines and tumor necrosis. Now, there are 10 traditional Chinese herbs in Formula 101, and this formula is now being distributed in countries in need around the world. Pretty awesome, right? Traditionally, the raw herbs are cooked in water and consumed as a tea. However, many herbal pharmaceutical companies provide these herbs in granule form. Now, granules are easy to distribute in bottles, they have an extended shelf life, and they're always ready to use. So Formula 101, it showed the ability to reduce SARS-CoV-2 viral growth. Research done on the individual components of the formula identified 2 herbs which stood out in their ability to block the binding between ACE2 and spike proteins in an ELISA assay. These 2 herbs are Scutellaria root and heartleaf houttenia. When individually analyzed, they were able to inhibit TNF, or tumor necrosis factor production. On top of that, the HPLC, the high performance liquid chromatography fingerprint analysis of Formula 101, well, it found 17 major compounds, all of which were deemed of value in the treatment of SARS-CoV-2. So the data revealed 3 caffeolequinic acids, 4 quercetin glycosides, 2 rutin, 2 crystalline C glycosides, a bacillian type flavonoid, and I may have not pronounced all of those correctly, but many other flavonoids were isolated, suggesting that the flavonoid's fingerprint is closely correlated to the inability or the activity of Formula 101. Oh, it's a mouthful. The combination of the herbs working together created the therapeutic dose and preventing the cytokine storm. There were no side effects noted, and patients were able to achieve negative test results within 9 days. So in conclusion, the antiviral and anti-inflammatory effects of Formula 101 have demonstrated that it may be used to inhibit the mechanisms of SARS-CoV-2 invasion and proliferation. So that's the science. These herbs are used throughout Asia, And many Asian countries like Taiwan and Japan include Chinese herbal medicine in their national health insurance coverage. East Asian herbal medicine, or TCM, traditional Chinese medicine, is a viable alternative that we are not hearing about in the US. Many acupuncturists like myself are trained and licensed in the use of these herbs. Herbal solutions are readily available, non-invasive, and proven safe over centuries of use worldwide. Thanks for watching. Keep an open mind to the possibilities in botanical medicine, because plants give us so much more than just food.